Hello everyone. Myself Dr. Harish, completed MD in Kayachikitsa from SDM College of Ayurveda and Hospital Class. Today I'll be discussing the most burning topic of AIAPGET. So today, why interns, AIPGT aspirants score less in AIPGT and common mistakes nobody talks about it. So today's discussion point is this, and why interns or AIPGT aspirants score less in AIPGT even after studying well. So if you are an intern or a recent graduate or an AIPGT aspirant, so this video is specially made for you. So realities, mistakes, and solution for all these we are talking about. Good. So let's start the video. So coming to the first thing, the common questions. So, what are the common questions you are getting as an intern, as an AIPGT aspirant? So, many interns they tell me, so I have a good knowledge. I have attended OPD, I did IPD works, and I know clinical knowledge. Still, my marks are very less. Like the interns who have attended a AIPGT one time and they are not scored good marks in their AIPGT. So, this is the most common question. So, even though they are having good skills, good knowledge, they are scoring a low marks. Why? Why this is occurring? So the truth is AIPGT is not testing how much you know. So here, like how you are studying or how you are writing your theory exams, likewise, the same thing is not there in AIPGT. AIPGT is completely a different form. So here MCQs are playing a role. So here the knowledge what you are having, that knowledge is in an abundant form. But in AIPGT, only MCQs are asked. So here that abundant knowledge will confuse you to write the or to solve the MCQs. So here if you are having a good knowledge, then expecting like a good score in AIPGT is not like a not accepted. Okay, so here the main thing in AIPGT is cracking the things, cracking the or molding the things. So you have to have the strategy to solve the MCQs. So if you know the strategy to solve the MCQs, and definitely will marks or rank will be good. So having good knowledge about the theoreticals or practicals, so it is good. It is good for your IPD, OPD duties, but for AI PGT, you need to have a strategy. So more than a knowledge, you should have a strategy. So you may have a question in your mind that I have a good knowledge or having a knowledge. So is it good or not? In AI PGT, you need to have a knowledge and directly you should know the cracking MCQs. Like you should have one strategy. So if one question is given, in that question, what should I read? And in that the MCQs which are given, options are given, which are given. So in those MCQs, what I can do. So this strategy, if you apply to whole your AIPGT course or AIPGT exam in your exam, definitely will score a good marks. Definitely will score the good marks and definitely you'll get the good stats. So here so having a knowledge, it is very good, but that knowledge you should know how to approach or how to apply that knowledge in a pressure time bound. So we'll be having a minimal time in a AIPGT for each question. You may get at least only very less like only 1 minute you get for thinking. Also, you will be not having a time. So for reading a question only, you will have you need around 30 to 40 seconds. For that, you should have a strategy. Okay. Next is no exam orientation. So during your internship, you'll be not having any exams. So the thing is, during your BMS course, you'll be having exams every 6 months or every 3 months. So you'll be having IAs, you'll be having term exams, you'll be having the year-wise exams. But during internship, it is not possible. During internship, you'll be having the postings, OPD, MPD, OT, etc. So outside, you'll be having the postings. So here you are only approaching one practically. So the theory, what you have studied in your BMS, that you are applying in your internship. But here, no one will assess you. Like how assessed in your BMS UG. So no one will assess you. So they'll ask the questions. So if you answer, they'll hook up with you. If you don't, they'll leave you. So there, no one will be having a interest or urge to teach you. So the thing is, the many teachers or assistant professors, what they do is they try to mold you during your internship to make you ready for the AIPGT, but you'll be not having interest as you have completed your ABM SUG and you have written many exams and you'll be having your head weight has reduced. That's why you'll be free. Okay, you'll be free and you won't study. So this is the main thing. So you'll be not having an exam orientation, first thing. And another thing is like how you have given AIPGT MCQs. So how you will give AIPGT MCQs. That type of questions you won't answer in your theory paper. So only 20 questions you will attend in a new syllabus, only 20 questions you will attend. So that too according to your syllabus, the questions will come, MCQs will come, and you will attend. But there you won't be having much pressure. Only 20 marks are there. So in those 20 marks, if you score 10 marks, that is well and good. Other 80 marks is there. In theory, you will write and you will pass. But in AIPGT, this is not the same. So in AIPGT, you'll be having a questions. You'll be having a questions. You have to read. You have to read for AIPGT to crack or to make a strategy to crack the questions, not to understand the topics. So understanding topic in your UG is well and good, but for cracking MCQs in AIPGT, it is not acceptable. Okay, and then no focus on the topics. So one topic you are reading. So what you will get to know after reading on that topic. So in my UG, I have studied that topic. So no need to read it again. So that thing you'll be having in mind, and you won't study it again. So like how if you are good in one subject, that subject you won't read again. So this is the thing where you are getting a hurdle. Okay. Next, keywords. So you'll be having some keywords like the things are there. Something like synonyms, paryaya, and then types, and then acharya's different versions, different opinions. So those you have to focus more. So here the thing is, you'll be not having an exam orientation. You should focus on the topics which are repeated in AIPGT, like how you will get to know that repeated topics. Like you have to see the previous year question papers, PYQs we say, previous year question papers, and some exceptions will be there. So if you see the previous year question papers, in that you'll be having exceptions like so some topics will not be given more importance. So for example, Sushruta, Uttaratantra, Sushruta, Uttaratantra, in that Shalakya Tantra is given. Shalakya Tantra is given more importance. Other than that, another sthana is there, that is Kalpasthana. In Kalpasthana, whatever you are studying in your Agara Tantra, that is sufficient. In your subject, that is sufficient. No need to read again it in a Sushruta Kalpasthana. So these are some exceptions. So Kalpasthana, it is given less importance in AIPGT, Sushruta Kalpasthana. Got my point? So here you should know the keywords, exceptions, and repeated topics. Then only this creates the big gap between your study and score. So next slide is about the ignoring PYQs. PYQs means previous year questions. Previous year questions. So PYQs are the backbones. So this will give the clear image about the previous year questions. What will be the pattern? What kind of questions can be asked? And what kind of topics will be covered? Okay. So many times what interns or AIPGT aspirants will do is they ignore. So they or else they see the previous year questions and they won't give more importance for them. Okay, so why they want to give more importance? Because they are doing an internship or else they are studying for the AIPGT and they think that so these questions are occurred in a previous year, these questions won't repeat in the next year. But the pattern which is there in a in a previous year questions, the same pattern will be there in a this year questions also. So this is the main thing. So you should understand the pattern. You should not miss the pattern of questions. Okay, how the questions are asked. Okay, so here same concepts are repeated every year. So some topics are there, those topics are given more importance, and those are given more importance. And from the same concepts, the repeated questions are asked. You can see the previous year question papers. And then coming to the reading for the AIPGT, the interns, what they'll do read the books and so the patterns they won't remember, or else they won't see the previous year question papers and they won't recognize the patterns. Okay, so in terms what they'll do, they'll read the books. So if you're they start to read Rachna Sharira, they start to read the Rachna Sharira book. Okay, Rachna Sharira textbook, and then along with that Sharirasthana of Sushruta and Sharirasthana of Charaka they'll read, and they'll get the knowledge, but they won't get the patterns. Okay, next is here AIPGT only helps for the persons who are doing the smart repetition. So if you know one topic very well, okay, about the dosha, you know very well. Then that topic, if you are reading daily, if you are repeating daily, then you can move that topic according to your well wish. Okay, according to your wish. So what you will do, your mind will recognize that topic again and again. If you read, your mind will or your brain will catch that topic and it will mold according to the need of a pattern. Okay, so if you read repetition, so if you do the repetition, then there is no need of fresh reading. So AIPGT rewards only smart repetition, not like reading for the theory papers. Okay, and then you will be having a internship over confidence. So this is the main point what I want to say. So during your internship, you will be having a overconfidence on what kind of confidence. So you'll be seeing more patients, and you'll be posted in different hospitals, or you'll be going to modern hospitals. There you will see different patients, and you'll try to get the pattern, like how patient will come, and how he'll present to the OPD, how he'll present to the IPD, and what can be done, what can be done in casualty, what can be done in ICU. You'll get to know, and according to that, you will act. This confidence, this what you say, the internship overconfidence. So this won't be asked in the AIPGT. It might be asked one or two questions are more enough. They might ask from the internship. But other than that, all other questions, 98% of questions are theory related, or the MCQs are related to your BAMS course. Okay, so because of the internship confidence, you'll be having a good confidence in your OPD, IPD. But in AIPGT, clinical exposure is not equal to the exam readiness. Here, you have to work hard. You have to work hard. You have to see the PYQs. You have to work repeatedly. You have to read the topics. You have to make your own pattern to understand the topic. Okay, so clinical exposure is not equal to the exam readiness. So in AIPG, what kind of questions are asked? Samprapti order, definitions, and then classical references. So in your OPD or IPD or in casualty, these definitions, classical references, Samprapti order are not asked, or are not given more importance. Okay, there, Chikitsa and how it can be done, how it can be managed are taught. Other than that, the Samprapti order, definitions, and classical references, so these are not discussed more. So even though these are discussed, randomly they'll say, I think this might be the thing. So we have to act according to the scripture, etc. They'll say. But in AIPGT, the classical references are given more importance. In classical, Samprapti are asked, classical definitions are asked, the classical reference for each topics are asked.